so-called health insurance personalized. It is a consumer-driven, patient-centric system, folks. Today's topic is consumer-driven healthcare, so-called healthcare consumerism. Let's go into a little more details. If you are a health insurance consumer, most of the efficient free markets always responds to the consumers' demands for products, services, and information, folks. Information. It is trying to try a system that focuses on consumer and the patient's needs. A lot of people will tell you, oh, we have tried the free market approach before, years before Obamacare. But prior to the Obamacare, insurance was not on a free market. A lot of people don't seem to address that, folks. It has never been on a free market. Healthcare has never been a free market. It is always, consumers have been ignored in the healthcare delivery. You and I know that the healthcare so far we have had has been dysfunctional. Even prior to Obamacare, there were 27 million uninsured. That's how Obamacare has come into force, because of too many uninsured. President Obama was concerned. That's how he was able to implement Obamacare. Prior to the Obamacare, these healthcare lobbyists had their way. Structure included laws and regulations where consumers were powerless. Number one, consumers were powerless when seeking to purchase an insurance. They were powerless. They had no control. Number two, insurance restricted providers and services patient could access. They always restricted the services and access to care. That has been all along prior to the Obamacare. And number three, this is all prior to the Obamacare. Cost and quality of the care was hidden. It was hidden from the consumers, all of us. And number four, individual consumers had no power to negotiate premiums or understand why they were rejected to begin with, why they were rejected for the coverage. And number five, few powerful insurers, limited coverages and provider alternatives, plan choices, innovation, and pricing competition. Just few insurers really limited the coverage, provided alternatives, plan choices, and limited the innovation and limited price competition. This is by few. Laws and regulations were mostly written by insurance industry lawyers, folks. Insurance industry lawyers. As you all know, limited competition, market share drives the process. So-called consumers were ignored to begin. They were ignored. We don't want to go back to that system, folks. We really don't want to go back to the system. We can't let industry lobbies write the laws on post-Obamacare era. We will get shafted again, as consumers, we will get shafted again for the second time. So we don't want that, folks. We really don't want it. If you are a consumer, efficient free markets always respond to consumer demands for products, services, and information. But we never had a free market for health insurance. We never had a free market for health insurance. A lot of people will tell you, but we never did, because it was always controlled by the lobbyists and insurance carriers. It is time we tried so-called consumer-driven healthcare, otherwise known as personalized healthcare. It is time we try that. So it is the politicians and insurers are not working to help you or me, folks. This is where the problem is. Politicians are not helping you or me. They have been always promising repeal and replace plans, so-called plans for last 10 years. They have been trying to repeal and replace. Yet nothing gets done. This is the problem. Nothing gets done. They are unable to or unwilling to develop alternative to Obamacare. I'm not sure what President Biden is going to do, because Obamacare, the problem was it raised the premiums for rest of the folks. So that's what happened. So we need to revisit how we can address the consumers in this whole process, and it has to be a consumer-driven healthcare, folks, so we can have freedom to choose the plan, choose the insurance, choose the doctor, choose the hospital, choose the lab, choose the facility, what you like, and it is up to the consumers. The only way these lobbyists have been fighting hard against account-based plans, so-called health savings accounts. They've been fighting hard. Why? Because health savings accounts put control into the hands of the consumer. That's one of the reasons why insurance lobbyists have been fighting hard against consumers in control. You have to understand, you have to recognize the truth. Insurance companies never wanted consumers to be controlling the cost. So lobbyists and existing vested interests will preserve the status quo and work against your interests in choices, treatment options, and affordable insurance. They work against your interests. Let's see what the Biden administration does, because we as consumers need to be involved in whatever the decision that comes out of the whole healthcare aspect of it. It is time we demand change and acknowledge the unique needs, such as personalized health insurance. Unique needs under the personalized health insurance. This personalized health insurance is consumer-driven, patient-centric. And the approach is basically insurance what you want, when you want it, at an affordable price. That's what we want. It has to be consumer driven. So consumers can make a choice when you want it, how much and what price you want to pay for the insurance. You and I basically want coverage in improvements. That's what we want. Coverage in improvements, affordability, and more treatment and healthcare options. That's what we want. And it is time for all of us to take control of the healthcare. Like any other sector, folks, we can do, if consumers take charge, we can control the costs, folks. Only consumers can do that. Nobody can control the costs better than the consumers. We can't let insurance bureaucracies or even government come between the patient-provider relationship. We can't let that happen. They should be coming between the patient-provider relation. They shouldn't be coming in between. Whatever the approach is, consumers need to make a choice and they should be able to get what they want. And we cannot let them set the rules and tell the doctors what they can and can't do. That's not right. Insurance companies cannot tell the doctors what they can do, what they can't do. They cannot be allowed to say where you can see, what we can see for our healthcare, and what treatments we were prescribed. So they can't do that. They cannot control that aspect. So it has to be consumers. It has to be consumers. So how does the personalized health insurance will improve the delivery of care, you may ask? How does a personalized health insurance improve the delivery of care? And how does it lower the premiums? How do you see improvement quality of treatments and choices, folks? How does it do that? Personalized health insurance includes most popular Obama consumer-oriented features. This is what the beauty is. Personalized health insurance focuses on the Obamacare consumer-oriented features. What are they? Number one, guaranteed issue of coverage. That's number one. Yes, personalized health insurance can do that. And number two, coverage for pre-existing conditions. Personalized health insurance can do that. And dependent children, coverage to the age of 26. That is a happy medium, folks. There are no qualms either way. So that is a transition period from dependency to independency to get personalized health insurance. And number four, unlimited lifetime maximum coverage. Unlimited lifetime maximum. And last but not the least is number five, comprehensive major medical insurance coverage. That's what we need. Comprehensive major medical insurance coverage. Personalized health insurance builds on the strengths of this country, folks. It builds on the strength of this country. It includes efficiencies, innovations, choices, and consumer focus of a free market with consumer protections, patient empowerment. Yes, patient empowerment and limited government oversight, folks. So there is a government oversight, but it is limited. It does not include least popular features such as pricing, distortions by distortion by age, and excessive coverage mandates. It doesn't include excessive coverage mandates, limited policy choices, and also it limits risk pooling. So we need to have a risk segmentation, not risk pooling, general risk. So it limits that. If we cannot unite around a consumer-oriented personalized health insurance, then surely we will all head towards one size fits all government structure that fails to meet the unique insurance need, folks. That fails to meet the unique. That's what we need. We need America to be number one in healthcare. We have seen healthcare in other countries, Canadian healthcare, British socialized medicine. The healthcare is not what we are looking for. We want America to be number one in healthcare delivery. Only way it can be achieved is through consumer-driven healthcare, folks. That's the only way we can. We have been spending so much on healthcare, and after spending $3.7 trillion, we rank 37th among the most advanced countries. That is simply not acceptable, folks, and not acceptable. We want to be the number one in healthcare delivery. We are number one in retail. We are number one in groceries, and you're talking about food deliveries. We are number one in other sectors. Why can't we focus on being healthcare to be number one? That will happen only if you give the control to the consumers, folks. Consumers demand price transparency for insurance companies. They want affordability for the insurance company. They want coverage, pre-existing coverage, and they also want lifetime maximum coverage. They can have a deductible up to a certain amount. Consumers can lower the premium by having a deductible plan. That's what HDHP. I renamed it as Health Disclosure Healthy Pricing. When you say deductible, people get all worried. Oh, we don't have the money and this and that. Once you have a health disclosure, if you're in well category, your premiums have to be lower. If you're in at-risk category, your premiums have to be lower. And in chronic illness, your premiums have to be based on chronic illness. That's where we need to focus on. That's where we need to segment it, and that way we can focus on who need the care the most, especially people with chronic. Right now, we are not focusing on those folks. We're just giving away the Medicaid and Medicare and just let everybody, and let middlemen are swindling. This is what is happening. Department of Health and Human Services, if you're listening, you cannot be investing in mid-level agency. Why can't you invest in Americans where they can do a better job than investing in mid-level managed care organizations? Once you involve mid-level managed care organizations, very first thing they do is to curtail the services, especially people with chronic illnesses, especially with people, they are the one who need to pay the attention. In personalized healthcare, we pay attention to the people who need the care most. And the insurance premiums are not based on general risk. It is based on 4 categories. It is a well category. If a person is healthy, your premiums have to be based. Majority of the Americans, 68% of the Americans are healthy folks. Their premiums, you cannot put them in a general risk pool and give. You need to lower their premiums, lower their, if they participate in the deductible so-called health disclosure plans, your premiums have to be lower. It should not be more than a couple of $100, folks. It should not be. Whereas at-risk category, there are only 12% are at risk. Actually, it's 15% are at risk. 15% of the entire population at risk, their claims are 20%. We can put an emphasis, like in a smoker developing pneumonia, hypertension causing strokes, and multiple other problems. We can focus on these people and give them education classes, and people with more obesity, they need to be given all the incentive to participate and improve on their health so their premiums could be lowered, folks. This is how it works. And number 3 category, chronic illness. This is where we need to pay the attention the most. There are 15%, actually there are only 12%, I would say 15%. 15% have chronic illness, the entire population. Their claims are 48, whopping 48. Almost half of the claims are from people with chronic illness, folks. This is where we need to be paying attention. By giving Medicaid, it doesn't do anything. And nobody wants to take care of the Medicaid patients. Nobody wants even, they are being neglected. That's not right. By giving this so-called Medicaid and managed care plans, I've noticed this Medicaid, Medi-Cal HMOs like SCAN, Molina, all these mid-level agencies, they're enriching themselves, taking the money from the government and cutting the care, taking away the service. That is just not acceptable, folks. You need to focus on the people. We need to give a certificate of guaranteed coverage for people with chronic illness, especially with people with chronic illness. We need to pay attention to this category, folks. I cannot emphasize more than that. That will bring down the cost for the entire sector in the healthcare. We don't need to spend 3.7. As a matter of fact, people in the lower income bracket, invest in those people, give them the personal care accounts and give them funds deposited into the personal care accounts so they can take care of themselves. Instead of giving the money to the mid-level agents, I would rather put that, whatever the $6,000 into the accounts of the people who can't afford to take care of themselves. That will give the consumers to shop for the healthcare, demand for the lower cost, demand for the efficiency, demand for more transparency, and demand for quality. That's the only way we will come out ahead, folks. I cannot be more emphatic than that. Again, that is the best option we have by having consumer-driven, patient-centric, personalized healthcare. Folks, I hope you got my point, what I'm trying to say. Focus on people. There are only 15. You don't think we can take care of the 15% of the chronic illness out of 320 million? That is, we can do that. And these people are uninsured. If people don't get the insurance, they lose a personal exemption when they file their taxes. A lot of people, some of these people are, you know, fairly rich and they don't buy the insurance, they lose the exemptions. They do the exemptions for an individual and for the family. So that will make everybody. As a matter of fact, by enforcing that, we can collect more revenue. People who are uninsured, if they don't buy the insurance, they come in the category of uninsured. So they're losing exemptions for themselves and for their family. So state and federal government can collect more revenue. That revenue goes toward the impaired health support plans, folks. That is the best solution we have got. And I would definitely feel that by giving the control to the consumers, it will be win-win for employer, employee, and even for the government. It's win-win for everybody, folks. Let's look into it. Let's explore that personalized healthcare option. And if you do like this channel, subscribe, share, and hit that notification bell. Please make some comments, and I would love to hear your comments. Guys, I love you. I love you. As a consumer's doctor, I'm fully dedicated. The least I could do on the behalf of personal health, on the foremost organization, is to recommend what is the best for an American consumer. That is my job. I would like to see especially people who can't take care of them, impaired health support group. That's what I want is I want them to get the best care. The only way we can achieve it through a personalized healthcare, irrespective of the economic status, folks. This is the beauty. It doesn't matter if you're economically impaired. More so, you will get a certificate of guaranteed coverage, and you can see your own doctor. You can go to your own facility. You can see anyone whom you want, and you can get the best medication. Thank you, guys. Thank you for listening, and we'll see you in the next episode. Goodbye.